Hello friends, welcome back to Front of Health. So today we are going to see important health planning committees in India. So this is not a complete presentation. Some of the committees are missed, or the main programs of social and preventive medicine are not included. Only the important 6 committees like the Bohr Committee, Mudaliar Committee, Chadda Committee, Mukherjee Committee, Jungalwala Committee and Kartar Singh Committee are included, and the major recommendations and the appointed year, all those things. So this will help you if at all a question comes. So the patterns of question, how questions can come, everything we'll discuss in this video. So important health planning committees in India. First one is Bohr Committee 1943. So appointed on October 1943 and chairperson Sir Joseph Bohr. Major recommendations are establishment of a national health service with integration of preventive and curative services. Short-term plan and long-term plan. So you can expect a question like all the below are correct except, like that you can expect a question which is very simple type of MCQ, where one question will be there and 4 options will be there. You have to choose one wrong answer or the correct answer from the below. But in the last AIAPGET 2020 or the UPSC 2020, if you see the type of statement types and assertion reasoning type and multiple choice are more, around 16 questions from statement type, 16 from assertion reasoning type, and also from the multiple option type. So multiple option type they can ask like 1 and 2, 1, 2, 3, 1, 2, 3, 4, like that. You should know the whole concept, all the recommendation you should know, the year of constitution you should know, the chairperson name you should know. So that's why this becomes important of studying in a mind map setup. So mind map is a useful education technique where you can learn things easier at a glance. In one site only you will get all the information. So we will be uploading this mind map in the Front of Health Android app so that you can download and study. So I'll tell you how the questions can be framed. So major recommendations of Bohr Committee 1943 is establishment of a National Health Service NHS with integration of preventive and curative services. Short-term plan is 1 PHC per 40,000 population. Each PHC to have 2 medical officer, 4 public health nurse, 1 nurse, 4 midwives and 4 trained DIs each, and 2 each sanitary inspector and 2 health assistants. So 4 midwife, 4 DIs and 2 sanitary health inspector and 2 health assistant, 1 pharmacist and 15 class 4 staff. So 1 PHC, 2 medical officer, 4 public health nurse. So these things are important recommendations for the short-term plan. And long-term plan, also called as 3 million plan, it was proposed in a 3-tier level. So first tier you can say proposed for district with population of 3 million. That's why it's called 3 million plan, long-term plan of Bohr Committee. So first tier 75 bedded PHC, 1 PHC per 10 to 20,000 population. And the secondary level, the second tier, you can say 1 secondary hospital which is 650 bedded for 15 to 25 PHC. That is kind of a referral system. So from the PHC which is 75 bedded, a secondary hospital which is a referral system, 15 to 25 PHC will be there under that secondary hospital. And the third tier, the third level, district level hospital, 2,500 bedded. And modify medical education to produce social physicians. This itself can come as a simple MCQ type question, direct question, where the question will be social physicians are one of the major recommendation by which committee. So other committees names will be there. Bohr Committee is the answer. 1943, before the independence of India, the committee which was for like constituted in the British India, you can say 1943 Bohr Committee. So the social physicians is a concept where 3-month training will be given for the in the subject of social and preventive medicine to develop doctors for servicing in the PHC level under these committees. So social physicians, Bohr Committee. Increase bed population ratio to 1.03 bed per 1000 population by the end of 10 years. That is another recommendation. And the next important committee is Mudaliar Committee 1962. So 1962 if you say Mudaliar Committee, but it was appointed on 1959 12th June 1959, and chairperson was Dr. Lakshmana Swami Mudaliar. And major recommendations are consolidation of advances made in first 2 5-year plans, strengthening of district hospitals, each PSC not to serve more than 40,000 population. So number wise you can number it and study, so that this, if it comes in a multiple option type, easily you can answer. If it told someone, for example, Mudaliar committee, each PHC should serve more than 40,000 population, may be an option. So you should understand that that is not a recommendation, that is the opposite. So that is wrong. Like that you have to understand the questions. So each PHC not to serve more than 40,000 population was the recommendation by Mudaliar committee 1962. And improve quality of care provided by PHCs, constitution of All India Health Service. So IAS pattern, Indian Administrative Service pattern, All India Health Service was recommended by Mudaliar committee to improve the health services. And integration of medical and health services as recommended by Board committee, that also the integration is recommended by Mudaliar committee. And regional organizations in each state to supervise 2 to 3 district medical or health officers. So that was another recommendation. So here you have to note All India Health Services in the pattern of IAS, and not to serve more than 40,000 population. That was the major recommendations by Mudaliar committee. And Chadha committee 1963, appointed on 1963 10th April, you can remember as Handyman's Day, 10th April 1963, Chadha committee. And major recommendation, the chairperson was Dr. M.S. Chadha. And major recommendations, basic health workers to work as multi-purpose workers, 1 per 10,000 population, and establish sub-centers, minimum 1 per 10,000 population, ideally 1 per 5,000 population. PHC to have microscope, lab technician, general health services to be responsible for maintenance phase of NMEP. NMEP means National Malaria Eradication Program. So all the programs are important. National Leprosy Eradication Program, Malaria Eradication Program, tuberculosis, all the programs are important. So here Chadha committee main recommendations are multi-purpose workers, and also the microscope and lab technician. You can say for malaria you have to test the malaria slides, so microscope and lab technician, and NMEP, general health services, to be responsible for maintenance of a phase of National Malaria Eradication Program. Chadha committee 1963. And the other committee is Mukherjee committee 1965, appointed on 31st December 1965, chairperson Mr. Mukherjee. Major recommendation, dealing family planning activities from other activities. So here the focus is mainly Mukherjee, mainly focusing on the family planning. So other activities, when it is linked with family planning, it is not given equal importance. So dealing family planning activities from other activities, strengthening of district family planning bureaus, and provision of family planning allowance to doctors, and training in family planning methods should be provided. These are the recommendations by Mukherjee committee. And the Jungalwala committee 1967, even if it is said 1967, it was appointed on or set up on 1964, and chairperson was Dr. Naushir Jungalwala. And major recommendations, unified cadre, common seniority, recognition of extra qualifications, equal pay for equal work, special pay for specialized work, and no private practice. That you have to focus. No private practice was a recommendation by Jungalwala committee 1967. And good service conditions. These are the major recommendations of Jungalwala committee 1967, which was appointed on 1964. And the last one, Kartar Singh committee 1973, appointed on 28th October 1972, chairperson Mr. Kartar Singh. And major recommendations are having multi-purpose workers is desirable and feasible, integrate vertical programs at all levels, and create new job description and designations. So the existing ANM, the auxiliary nurse midwife, was to be called as health worker female, and male multipurpose workers to be called as health worker male, and supervisors health supervisor male or female, and 1 health supervisor per 4 health workers, and 1 PHC per 6 sub-centers. So 3,100 population each, and 1 PHC per 50,000 population. So 1 PHC will have 6 sub-centers with 3,100 population each, and 1 PHC will be for 50,000 population, and 1 health supervisor per 4 health workers. And impact of this Kartar Singh committee recommendations are many vertical programs suffered as the multi-purpose workers were unable to do work previously done by dedicated staff. Resurgence of malaria happened, and resentment from dedicated staff as they were used for general health activities. So these are the impact of Qatar's in committee. You can read this like mind map in the Front of Health app. So this is all about the important committees. Other committees like Srivastava committee is not included, and also the very important National Rural Health Mission NRHM, or the Rural Health Scheme, and the National Ayush Mission. All these programs you have to study, and all the important programs like NLEP, National Leprosy Eradication Program, NMEP, National Malaria Eradication Program, then the tuberculosis program, then the immunization schedule. All these are important. So you can download the Friend of Health app and get these kind of mind maps and free test, and also chat with us, and also you can take part in the real whoever is going to attempt the exams with you for state PSCs. You can make groups and you can study. We are also creating batches which will help us to interact with the students in a kind of whoever is preparing for one kind of exam, for UPSC or for Andhra PSC or for Kerala PSC. So you can have a free groups and chats there, and if possible we will also try to create some courses which are helpful. So all the best wishes.